The hardest part of dying for me is not the dying. It's not the living. And by that I mean I have to leave my wife. If there's anything that can bring tears to my eyes and sadden me more than anything, is I have to leave her alone. And she's gotta go on alone. And that is the hardest part of dying.
Every patient, no matter where they are, no matter what their diagnosis, is entitled to good, high-quality palliative care. There is help out there. It is available. The most important thing for you to do is ask. The hardest thing to do for us is to not be able to provide you the care that you need unless you ask for it. If you have problems, if you have concerns, we want to know about them. Sometimes patients worry about they don't want to pass on their burden to other people. They don't want to feel like a burden. And it's actually quite the opposite. Nothing makes us more sad and upset than knowing that a patient has been suffering unnecessarily. This is really one of those instances where we want patients to tell us, how are you feeling? Be honest, and we'll be able to provide help.
I was tremendously relieved by Dr. Cargill and the team to know that I was not going to pass away in pain, discomfort, and that they would be here or at hospice 24 hours a day, and that took the tremendous strain off of me and pressure and anxiety.
Palliative care has come a really long way. As a field, we've been growing in leaps and bounds. The number of practitioners that we have, the number of organizations, the skill, the education, the training, every day it's growing and growing. But we still do have a long ways to go. But if I'm reassured by one thing, it's the passion and the level of interest. It just seems that more and more people want to get into this, more and more physicians are becoming interested in this, more and more patients are asking for it. It's going to be something that our patients are always going to need, and it's going to be something that I feel that they always should be entitled to, is good, high-quality palliative care.
It's hard to describe, to say thank you. That means more to me and my wife than, you know, if I gotta go, I'd rather stick around, but if I have to go, then they're going to allow me to go with my dignity, and they're going to be there for me. And so you end up with very strong feelings about people that like that.